welcome back. The topic today is about hypoacidity. We all know hyperacidity. What is hypoacidity? Hypoacidity, or the term is achlorhydria. That means low or no acid in the stomach. So we all know most of the times, even the previous video you talked about acidity, hyperacidity, ulcer. So what is hypoacidity? But it's very rare condition, but it's equally important conditions. So what is that? Acid, this hydrochloric acid, it is secreted from the stomach lining. The parietal wall has a lining that secretes HCl, hydrochloric acid. This acid maintains the pH level in the gastrointestinal tract. It's very important. So first and foremost, if you have a low acid level, what are the reasons it can happen? First is, we always say, atrophic gastritis. What is that? When the lining, the stomach lining is destroyed and it's like smooth surface instead of rugged one. It's a very smooth one where the superficial cells are destroyed. So the acid secretion is almost reduced or nil. So this is called atrophic gastritis. The second is H. pylori, Helicobacter pylori infection, that can cause reduced acid level because it has to survive. So it reduces the acid level. Number three, prolonged use of ulcer medicines or antacids like PPI, proton pump inhibitors. People, especially, doctors will prescribe for a certain time, but the patients, they feel good with this medicine, so they will continue it prolonged because it's all available easily over the counter. So the over the counter products, they continue prolonged, so it keeps the acid level almost very low. These are the three major reasons. Apart from that, suppose somebody has undergone for gastric surgeries, they cut the stomach, like bariatric surgery or cancer surgeries, so they can reduce the acid level. Or because of the old age, especially after 65 years, the acid secreting cells are all destroyed and the secretion becomes lower and lower. So these are the common reason, or because of some certain medications, they can cause this low level of acid. Okay, what is that is going to affect mainly? First and foremost is going to affect is the digestion. So what is that? Acid is very important for all digestion, especially for the protein. So the protein digestion depends upon the acid. The acid is the one which activates the enzymes to digest the protein. So the protein digestion is completely disturbed, leading to problems. The same way, acid is very, very essential to for the nutrients absorptions, especially iron, vitamin B12, and other minerals like calcium, vitamin D. So people with hypoacidity, achlorhydria, their nutrition is affected, especially because of that. They can get iron deficiency anemia or B12 deficiency anemia, and even their bone can become thinner because of the lack of calcium and vitamin D absorption. And not only that, these acid is very much important. Even even the previous videos talked about is acid is bad. No, acid is really good. We need that. Why? It's, apart from the digestion, it also suppose some infection, bacteria, especially the best example, if a coronavirus goes in, or even any bacteria goes in, TB bacteria goes in, the acid will kill them. So it prevents unnecessary infection. It's a protection. So when acid level is low, you can get any infection, especially the bacterial infections leading to other problems. So this is also very important. And not only that, the acid is very essential to keep the pH value. The pH value is maintained in the body, like from 7.2, 7.4 to 7.7 kind of thing. So this is very important to maintain the good and bad bacteria. So the probiotics or the good bacteria has to survive, means you need to maintain. Otherwise, the good bacteria will go down, the bad bacteria will rise, causing other issues like infection, immunity problem. All this thing can happen. So acid is very, very, very important. And not only that, the acid is very essential for certain medicines to act. So the pH value to be maintained, so that certain capsules act this side, tablets will act this side. This is very, this depends upon the acid level. So acid is really good. Okay, how to diagnose your hypoacidity or achlorhydria? Hyperacidity, everybody knows. The same way, like it's a very simple test is available in home. You can do it at home, but it's not absolute, but you can try. If you can take a 1/4 tablespoon of baking soda, mix it with water, drink it. If you have acid inside, you will burp. If there is no acid, the burp will not come. It will like a neutral one. So this is a very simple test. But the doctors, they won't believe all those things. They will do two things mainly: the pH value, or even the acid, secretion. They put a tube inside, nasogastric tube kind of thing, will put inside, that will measure the pH value, and also quantity and qualitatively measure the acid level. This is one part. Then they may ask for a endoscopy. Endoscopy will show atrophic gastritis, H. pylori infection. Sometimes they'll take a biopsy to look for what are the reasons. The other way is, sometimes they'll do scan tests, looking for other reasons to rule out the causes for hypoacidity. Okay, fine. We have now we are diagnosed what is what, but what to do now? Then first and foremost is, doctors, they will say change your lifestyle, like, eat steam cooked food, avoid oily food and all fried items, split your meal into small 6 meals. Okay, all these things, but sometimes it will not be practically possible. So what we can do is, the doctors may prescribe you acid secreting acid tablets, which can produce acid, so that can promote the digestions. So you have to take it before the your food, so the acid level increases. That can promote the or it will promote the digestion effectively. Even absorption of nutrients will be promoted. But very importantly, whether you need all those things, but simply keep the timing of your food, avoid spicy, oily, fried foods, and keep everything steamed cooked. This is more than urgent. And also look for the nutritional deficiency. That is more important. Very, very important is, after all the things: iron deficiency, anemia, vitamin B12 anemia, even calcium, vitamin D, all these things. If you have a deficiency, that has to be supplemented. That is more important. Because achlorhydria, and avoid, very important, avoid, if a doctor prescribes PPI, that anti-acid or anti-ulcer medications, for a certain time, stick on to that. The dose and duration should be stick on to that. If you feel better, and you go to the over the counter product, I mean, you can continually take it, these medications, then it can lead to achlorhydria or hypoacidity. Because achlorhydria or even hypoacidity or prolonged period even can promote cancer in the stomach. So get the help of your doctor. He will guide you. Thank you.